Module 4. Effective communication in the workplace. Objective: to highlight the importance of effective communication in the workplace, focusing on interactions with supervisors, phone etiquette, emergency protocols, and teamwork among care providers. Lesson 1. Effective communication with your supervisor. Lesson 2. Communication with care team members. Lesson 3. Communication on the phone. Lesson 4. Emergency communication. Lesson 1. Effective communication with your supervisor. Objective: as a caregiver, clear and professional communication with your supervisor is crucial for maintaining a smooth and efficient work environment, addressing concerns, questions, or issues, such as conflicts with coworkers or scheduling problems, requires a proactive and solution-oriented approach. Address issues promptly. Delaying or ignoring issues can lead to bigger, more difficult problems that are harder to fix. Supervisors depend on caregivers to provide updates and inform them about challenges so they can assist in resolving them quickly. If you wait too long to report a problem, it may escalate, creating unnecessary stress for everyone involved. Don't wait for a problem to worsen. If something is wrong, whether it's a change in a client's condition, an issue with scheduling, or a concern with another team member, bring it up immediately. Address issues promptly. For example, if you notice a client is becoming more anxious or showing signs of discomfort, report it to your supervisor right away. Similarly, if you're having difficulty managing your workload or need adjustments to your schedule, communicate this early on so your supervisor has time to help. Stay calm and solution-oriented. It's easy to become upset or frustrated when faced with challenges, but letting emotions take over can cloud your judgment and hinder effective communication. Staying calm ensures the conversation remains constructive and productive. Your supervisor will be more likely to listen and take action if you approach the issue in a composed, solution-focused way. Stay calm and solution-oriented. If you're upset, take a moment to breathe and collect your thoughts before speaking to your supervisor. Emotions can cloud your ability to communicate clearly, so staying composed helps you express your concerns more effectively. Rather than simply pointing out the problem, think of potential solutions or improvements. For example, if you feel overwhelmed by the number of tasks, suggest reorganizing responsibilities, or ask if additional support can be provided. This shows initiative and a willingness to work together to resolve the issue. Be clear and specific about what you need. Supervisors can only help if they fully understand the situation and your specific needs. Vague or unclear communication can cause confusion and delay in resolving the issue. Being specific ensures that your supervisor knows exactly how they can assist you, leading to quicker and more effective support. Be clear and specific about what you need. When you raise an issue, be as clear and specific as possible. Instead of saying, "I need help," try something more detailed like, I'm having difficulty managing the morning medication schedule because of time constraints. Could we discuss a better way to organize it? Clearly outlining what you need allows your supervisor to assess the situation and provide targeted support or solutions. Whether it's adjusting your workload, offering additional resources, or changing a process. Maintain a positive attitude. A positive attitude fosters a better working relationship between you and your supervisor. When you approach challenges with optimism and a willingness to find solutions, it builds trust and respect. This, in turn, makes it easier for your supervisor to work with you and support you in your role. A positive approach also helps you stay focused on solving the issue at hand, rather than dwelling on the problem. Maintain a positive attitude. Even if you're dealing with a challenging situation, try to stay positive and constructive. Instead of complaining, focus on finding solutions. For example, if there's a scheduling issue, suggest a possible revision or ask for a meeting to discuss better solutions. Maintaining a professional and positive demeanor during conversations with your supervisor shows that you are not only focused on resolving the issue, but are also committed to working as a team to improve the overall environment and care quality. Taking responsibility and being proactive. Supervisors appreciate caregivers who take responsibility for their actions and are proactive in solving problems. It's important to show that you're invested in your role and the well-being of your clients, and you're willing to take the necessary steps to make things work smoothly. Taking responsibility and being proactive. When discussing a challenge, acknowledge your role in the situation, if applicable. For example, if you made an error or misjudged a situation, own up to it and explain how you plan to avoid it in the future. Be proactive in finding solutions, whether it's through adjusting your routine, seeking training, or asking for additional support. Your initiative shows that you care about the work you do and the people you serve. Lesson 2. Communication with care team members. Objective. Good teamwork involves sharing relevant information, asking for clarification when necessary, and ensuring everyone is aligned to provide consistent and effective care. As a caregiver, you play a crucial role in ensuring that the client receives the best care possible. You often spend more time with the client than other team members, which makes you a valuable source of information. Effective communication with the rest of the care team is essential for providing coordinated and high-quality care. Here's how you can improve communication within your team. Sharing relevant information. When you share timely and accurate updates about a client's condition, medication changes, or any changes in their care plan, the whole team can respond more appropriately. This ensures that the care provided is based on the most current information, reducing the chances of mistakes. Whenever you notice a change in the client's health, whether physical, emotional, or behavioral, make sure to communicate this with the rest of the team. For example, if the client's medication dosage has been changed, Inform everyone who may be involved in their care. This will prevent any potential errors in administering medication. For clarification, if you ever feel unsure about a task, instruction, or client need, asking for clarification ensures that you are following the care plan correctly. It prevents mistakes and ensures that everyone on the team is aligned. If something is unclear, don't hesitate to ask. For instance, if you're not sure about the specifics of a client's treatment, go to the nurse or the doctor for clarification. Asking questions shows that you're committed to getting it right and ensuring the best care for the client. Ensuring alignment. Everyone on the care team should be working toward the same goal, the client's well-being. When each team member is aligned on the care plan and understands their role, the care provided becomes more consistent and effective. Regular check-ins or meetings with the team are helpful to ensure that everyone is on the same page. If there's a new update to the care plan or a change in a client's needs, make sure all members are informed and know what actions to take. Providing consistent and effective care. When team members communicate openly and clearly, the care provided is more effective and consistent. This leads to better outcomes for the client, as everyone is working together with the same understanding of the client's needs. Stay in regular contact with the team, especially if there are any changes in the client's condition. Keep the lines of communication open and ensure that everyone is following the same care protocols. By collaborating and sharing important information, you help prevent gaps in care. Lesson 3. Communication on the phone. Objective, clear, concise, and professional communication is essential when answering the phone. Always confirm details and ensure accurate information is relayed, particularly in critical situations. Answer promptly and professionally. Promptly answering the phone ensures that you don't leave callers waiting, which can be frustrating, especially if they have urgent concerns. A professional tone sets the stage for clear and respectful communication. When answering the phone, always introduce yourself and your facility. This not only identifies you, but it also helps the caller feel they are speaking to someone knowledgeable and approachable. Answer promptly and professionally. A friendly greeting such as, "Hello, this is," your name, from, your facility name, "How can I assist you?" helps establish a positive first impression and opens the conversation smoothly. Example, "Hello, this is Tigist Kabede from Pacific Shore Adult Family Home. How may I assist you today?" Stay focused and take notes. Being focused helps you listen actively, understand the caller's concerns, and respond appropriately. Taking notes ensures you capture important details, which is especially helpful when you need to refer back to the conversation later, or pass on information to other team members. Stay focused and take notes. Keep a pen and paper, or a digital note-taking tool, nearby when answering calls. Jot down important points, like the caller's name, purpose of the call, key information shared, and any action items you need to follow up on. Example: if a family member calls to inquire about their loved one's medication, write down the medication name, dosage, and any specific questions or concerns they have. Smile while speaking. Smiling is a simple yet powerful technique that influences how your voice sounds. A smile can make you sound more friendly, approachable, and empathetic, which is important when you're dealing with sensitive issues such as patient care or family concerns. Smile while speaking. As you pick up the phone, consciously smile. Even though the caller can't see you, they can often hear the difference in your tone. A smile conveys warmth and reassures the caller that you are happy to assist them. Example: if a family member calls with a concern, a smiling tone can help calm any anxiety they may have, making them feel more comfortable and heard. Be clear and concise. In caregiving, time is often limited, and information needs to be passed quickly and clearly. Using concise, straightforward language helps avoid confusion and ensures that important details are communicated without unnecessary delay. Avoid jargon, technical terms, or unnecessary filler words. Focus on the key details that need to be communicated. Keep your responses short but informative, and ensure that the caller understands everything you say. Be clear and concise. Example: if you're informing a family member about a client's condition, rather than saying, "The client seems to be a bit out of sorts, and they are not doing well today," say, "The client is experiencing shortness of breath, and is receiving additional oxygen as prescribed." Confirm details. Confirmation helps avoid misunderstandings and ensures that both you and the caller are on the same page. It also gives the caller the opportunity to clarify any details if they have been misunderstood. After gathering important information or receiving instructions, repeat the key points back to the caller to confirm that everything is correct. This is especially important when discussing sensitive or detailed information, like medical instructions or appointment schedules. Confirm details. Example: just to confirm, you are requesting that the client's medication be changed from 50 milligrams to 100 milligrams, starting tomorrow. Correct. This ensures accuracy and minimizes the risk of mistakes. Relay accurate information. Accurate communication is critical in caregiving, especially when it comes to medical information, schedules, and client needs. Incorrect information can lead to mistakes that affect the health and well-being of clients. Always make sure the information you're relaying is correct. If you're unsure about something, ask for clarification or verify the details before sharing them with the caller. If you're relaying medical details, make sure they come from a credible source such as the client's care plan, a nurse, or a doctor. Relay accurate information. Example: if a family member inquires about their loved one's condition, and you don't know the exact details, it's better to say, "I'll check with the nurse and call you back with the details," rather than guessing. Maintain professionalism. Professionalism in phone communication helps build trust and respect between you, the caller, and your team. It ensures that even in challenging or stressful situations, the conversation remains productive and focused on resolving the issue. Maintain professionalism. Remain calm and composed, even if the caller is upset or anxious. Speak politely, avoid interrupting, and allow the caller to express their concerns. Your professionalism reassures the caller that their concerns are being taken seriously, and that you are committed to providing quality care. Example: if a caller becomes upset due to a misunderstanding, calmly acknowledge their concerns. I understand your frustration. Let's go over the details to make sure we have everything straightened out. Lesson 4. Emergency Communication. Objective: in emergencies, provide clear, calm, and direct communication. This allows for a quick and appropriate response to address urgent situations. In any caregiving or healthcare environment, emergencies are an unfortunate reality, and how you respond in these moments can have a direct impact on the safety and well-being of the client, colleagues, and even yourself. Effective emergency communication is critical for managing the situation in a controlled and effective manner, ensuring timely assistance, and maintaining a calm and organized response. Here's an in-depth look at how you can handle emergency communication in your workplace. Know the emergency protocols. Emergencies require immediate action. Knowing the emergency protocols ahead of time means you can act quickly and confidently when every second counts. Being familiar with these protocols ensures that you don't waste valuable time trying to figure out what to do or who to contact in the heat of the moment. Review the emergency procedures for your facility regularly so that you're prepared to act swiftly if an emergency arises. Know the emergency protocols. Know your chain of command. Understand who to report to, who can provide immediate assistance, and the key personnel involved in different types of emergencies. Example: fire safety officer, medical emergency team. Be aware of the emergency equipment locations. Example: first aid kits, defibrillators, fire extinguishers, and how to use them. Know the emergency protocols. Example: if you are a caregiver in a long-term care facility, and a resident begins to show signs of a heart attack, you should already know who to contact. Example: charge nurse or emergency response team, where the nearest AED is located, and what steps to take while waiting for medical assistance. Stay calm and focused under pressure. In a stressful situation, panic can cloud your judgment and make it harder to think clearly. Staying calm not only helps you think through the emergency procedures, but also reassures others around you that the situation is under control. Calmness is essential for maintaining order and reducing the chance of further stress or confusion. Breathe deeply and focus on what needs to be done. Stay calm and focused under pressure. Prioritize tasks based on the severity of the situation. For example, in a medical emergency, ensuring the safety and basic health of the client, example, checking their pulse or airway, comes before calling for help. Stay calm and focused under pressure. Avoid multitasking in a chaotic situation. Stay focused on one task at a time, and if possible, delegate other tasks to coworkers or team members. Example, if a resident falls and loses consciousness, you should focus on ensuring their airway is clear and that CPR is administered correctly, without being distracted by minor details or emotions. Delegate other tasks. Example, calling for assistance, or gathering equipment, to others if needed. Communicate clearly and accurately. Clear, direct communication ensures that all involved parties understand the situation, which is essential for a swift and appropriate response. When seconds matter, vague or misleading information can delay the necessary actions. Communicate clearly and accurately. In emergencies, it's not just about what you say, but how quickly and accurately you can relay the key facts. Be direct and specific. Avoid unnecessary details or emotional language. Stick to the facts to ensure the receiver of the information knows exactly what is happening. Communicate clearly and accurately. Provide the necessary details. Always include the most critical information such as situation, what is happening, example, the patient is unconscious, not breathing, location, where is it happening, e.g., room 305, West Wing, actions taken. What steps have been taken already, example, CPR has been initiated. Communicate clearly and accurately. Speak at a measured pace. In stressful situations, it's easy to rush through the information. However, speaking too quickly can cause confusion. Speak calmly and at a steady pace to ensure clarity. Stay on the line if needed. If you've called emergency services, stay on the phone to provide them with any additional details they might request, even if the situation starts to calm down. Communicate clearly and accurately. Example, if you're calling emergency services for a patient having a stroke, you would say, "Hello, this is your name, calling from your facility name. We have a patient, Mr. Samuel Doe, who is showing signs of a stroke. He is in room 212. He has slurred speech, facial drooping on the left side, and is unable to move his left arm. We've administered oxygen and are monitoring his vitals. Please send help immediately." Communicate with the right people. Knowing who to communicate with ensures that the right people are informed and can take the necessary actions. This could be within your facility. Example, nursing staff, emergency response team, or outside. Example, emergency medical services. Quick communication with the appropriate individuals can ensure that the proper resources and expertise are mobilized immediately. Communicate with the right people. Know the roles of other team members. Understand who is responsible for what in an emergency. For example, you might contact a nurse for medical assistance, but the facility's safety officer may need to be contacted for fire-related emergencies. Communicate with the right people. Contact emergency services directly when necessary. If the situation requires external help, such as paramedics, don't hesitate to call 911 or your local emergency services immediately. Don't wait for someone else to make the call. Use internal communication systems effectively. In some facilities, there may be internal messaging systems or emergency buttons that can alert everyone at once. Communicate with the right people. Example, during a fire alarm, you may need to contact the building's safety officer, while simultaneously making sure that the client is safely evacuated, and the medical staff is informed of any possible injuries. Follow up after the emergency. After the emergency is over, following up ensures that all the necessary documentation has been completed, and that all team members are informed of the outcome. It also provides a chance to review the incident and learn from it to improve future responses. How to do it. Document the incident. Write down everything that happened, including the actions taken, and any communication made with other staff, medical professionals, or family members. Debrief with the team. After the situation is under control, have a debriefing with your team to review what went well, what could be improved, and whether the response time was adequate. Notify family members as needed. In certain situations, it's important to communicate with family members about the emergency. Make sure to follow the facility's guidelines on how to do this appropriately. Example, after a medical emergency, you might need to submit a report detailing the timeline of events, the actions taken, and the final outcome. This helps your supervisor assess how the situation was handled and make any necessary improvements to the emergency protocol. Congratulations! You completed Module 4. Please complete the quizzes. Congratulations! You completed